This conference will now be recorded.
Okay. All right, so it's recording. It's almost 11. Let me bring this over here so I can control it. I can sit off to the side, but I will introduce you. Hopefully. Okay. Good morning. The Missouri Aging and Disability Research Network is happy to present a webinar on the Americans with Disabilities Act. We have Kimberly Walker from Paraquad who's going to introduce herself and get us started. Thank you.
All right, thanks. So my name is Kimberly Lackey, and
I'm so sorry.
And I'm the Senior Director in Public Policy for Public Policy and Independent Living in Paraquad. I've been there about 13 years. I'm also an attorney, and I get to work with issues with the Americans with Disabilities Act and disability rights on a pretty daily basis. So it's my understanding here today that we're going to talk a little bit about the overview of the ADA. I don't know if any folks will have any questions. I'd love to answer those along the way, but any information that you've always been wondering about the ADA or rights of persons with disabilities, I'd be happy to provide some information about. So should we just jump right in?
Yeah, we'll just jump right in, and I'll kind of keep an eye out on our chat window and see if anybody proposes any questions.
All right, great. So the Americans with Disabilities Act, it was passed in 1990 by President George W. Bush, and it was the most comprehensive civil rights law of its time that provided rights for people with disabilities. And it was pretty groundbreaking at that time. There were many, many advocates that came together, grassroots, grass tops, for years to see that law come to fruition. There's videos online that you can go to YouTube and watch the actual signing, and you just see the lawn of the White House just filled with disability advocates, and it's a pretty amazing thing to see. The ADA is divided into 5 different titles, and Title I of the ADA talks about the rights that people with disabilities have regarding employment. And Title II talks about the rights within state and local governments, which includes also public transportation, which is a big one for people with disabilities. And then Title III is the rights regarding public accommodations or private entities. So this is really any privately owned business in the community.
Okay.
Like your stores and movie theaters and any recreational facilities, things like that. And then Title IV is an interesting one. It talks about telecommunications, and it talks about the need to have like a TTY service.
Okay.
But if you think about it, since it was passed in 1990, wasn't much talk of the internet back then. So the internet and like access to websites and things like that is a very very big issue that's trending, and there aren't any legal standards or legal requirements or regulations yet that are across the board that apply to websites. But they are coming. It's just one of those examples of the law trying to keep up with technology. So. And then the last title, Title V, is sort of a miscellaneous title. It's got a couple of different things in there about like attorney's fees and prohibits retaliation for anyone who files a claim under the ADA.
Okay.
And it also sets up the 10 ADA centers across the country. So these are the technical assistance centers that was established under this law. And the closest one to us is in Columbia, Missouri. It's the Great Plains ADA Center, and it's a wonderful resource, and it's full of information, technical assistance. They provide a lot of free services, trainings, things like that for businesses, organizations just wanting to know more about the law.
Okay.
So just jumping right into Title I. Just a quick overview is that it applies to employers that have 15 or more employees.
Okay.
So if you have fewer than that, then the laws of the ADA probably do not apply to you. Now keep in mind that states have their own similar laws.
Mm-hmm.
Like in Missouri, we have the Missouri Human Rights Act.
Okay.
And that applies if you have 6 or more employees. So always gotta be aware of the state and the federal law in a lot of cases. But if you have 15 or more employees, then you are required to provide all of the services and requirements under Title I of the ADA. So you basically cannot discriminate against a qualified employee with a disability.
Okay.
So you have to think about things like reasonable accommodations, effective communication, and things like that. So it's always suggested to have a very clear, written, reasonable accommodations policy for your business that employees can utilize when they need to request such an accommodation. And everybody knows exactly what that process looks like. And then, so Title II, talking about state and local governments, and including public transportation, they have to make sure that all the programs and services that they provide, like think about like the DMV or anything like that, you have to make sure that all those services are provided in an accessible way. So folks may need some alternative formats, or may need to have an interpreter if they're trying to receive some information about their taxes or something like that. That might be a pretty complicated subject. And of course, they also have to have what's called program access. It doesn't necessarily mean that every single city-owned or state-owned building has to be physically accessible.
Okay.
But if they're not, and somebody needs a service or program in that building, you have to make sure that you can take it somewhere and provide it somewhere that is accessible.
And I know that this kind of becomes more of an issue around these times of year, because we're starting to look at elections, making sure that people are able to vote, right? Like, that's a big deal.
That's a big deal. That's a great question.
Yeah.
We do a lot of advocacy at Paraquat around polling place accessibility and voters' rights. We do a lot of just nonpartisan voter education to make sure that people know about all the things that are available, like the Vote at Home program. So if you're permanently disabled, then you can sign up to have the ballot mailed to you.
Okay.
There's also a curbside voting. So if you have a disability and your polling place is not physically accessible, then you can pull it to the curb outside of the polling place, and there should be either a poll worker there or a sign with a phone number or how to alert somebody inside to come out with the ballot. And you can vote right in your car.
I had no idea.
Yeah. Yep. But then beyond that, we've also done poll worker trainings for folks, just to give them some tips about just awareness about interacting with people with disabilities, awareness about what kinds of accommodations people might request. I myself, I'm visually impaired, so I'm not able to fill out the paper ballots. So I either have maybe a friend or my husband that's with me assist me. And that's something a lot of people with disabilities don't even know, is you can have anybody that you want help you fill out your ballot. And there's also the electronic voting machines that can be very helpful in allowing somebody with a disability to fill out their ballot independently. So you can turn on an audio component to those.
Yeah, I've seen that demonstrated.
Yeah. So I've done that before with headphones and just use the electronic voting machine to fill out my ballot that way. So, and for all federal elections, they are required to use those electronic voting machines. There's always efforts to try to make them required for every election, which I think would truly provide equal access to everybody. So maybe one day.
Yeah, so that everybody can vote independently if they'd like to.
Absolutely. Yep. So along with that, a big one in there is public transportation. So things like here in St. Louis, our St. Louis Metro public transit, so our Metro buses, our Metro Link train, and our Metro Color Ride, which is what's called a paratransit system, along with things like Amtrak and Greyhound buses and hotel shuttles, are all required to be compliant with the Americans with Disabilities Act. One pretty cool thing about St. Louis's history is that we were actually the first city to have our bus company fully accessible with wheelchair ramps, and that was in the 70s.
Oh, wow.
Yeah, it's really cool. And they're always making them better. Like you have lifts, sometimes, a lot of times now with the new buses, they're just a ramp that folds out. So all the Metro Link trains are fully accessible. And, all of the Metro stations are, they've got elevators if they're needed or ramps. But if folks are not able to independently use the MetroLink bus or train, then that's where your Color Ride paratransit comes into play. So that's also, a curb-to-curb service. It's a shared ride program for people with disabilities, but it's very crucial for folks that can't otherwise use public transportation. And then let's see, Title III. I would say this is where I get probably the most questions about in my work. Just because, we've made buses accessible, we've made sidewalks for the most part pretty accessible, and we've made a lot of progress in integrating people with disabilities into the community, meaning like we've helped folks transition from institutions, nursing homes back into the community. And so now folks obviously want to go places in the community and have access to everything in the community. So that's where you're looking at your stores and your movie theaters and your baseball stadiums and just anything you could think of that you go on a daily basis. So a lot of, St. Louis is a bit of an older city, so there are some issues with accessibility still. But I think more and more there is awareness that is happening, and there are so anything that's built new, of course, has to comply with and be fully accessible. And that's usually not where the problem comes into play. It's with the older buildings, things that were built and in place before 1990. And just because maybe the amount of space or the landscape, it may not be feasible to make it accessible. And there's just not the length that you need to put in an accessible ramp, or there's no way to put in an elevator in this building because of the structure that it is. A lot of folks are, well, we just can't do it. But the law really doesn't, the regulations or the responsibility that you would have to provide that service doesn't really end there. You have to think kind of outside of the box. So if folks can't get into your store, can you take it out to them? Can you have a delivery service? Things like that. So think of alternative ways to provide that service if you can't truly make it physically accessible for folks to get in and use it.
Interesting.
So
I didn't know it expanded so much.
Yeah, a lot of, and that often just gets ignored. People are like, oh, I just can't do a ramp. You can see like there's only 2 feet here and we need 6 feet for an accessible ramp. And a lot of times the conversation stops there, and it really shouldn't. I think with physical accessibility a lot too, I get a lot of calls about, are there any grants or is there any money to help me make my place more accessible? And unfortunately, there's not really that many opportunities for that. I always make sure people know about the tax incentives that exist.
Okay.
So there are some, and I'm not a tax expert by any means, but there are some tax credits and tax deductions that mostly small businesses can utilize if they're making accessibility improvements to their facilities. So that's something. Anyways, we were actually, Paraquad was involved in, so every once in a while you do hear about a particular grant. So a large health company was had an opportunity for some smaller medical facilities to get grants in order to make accessibility improvements.
Yeah.
So things like that happen. So that was really cool. And we got to go to 5 small medical facilities over in Illinois and survey them and see sort of where they're at now and what improvements need to be made. And so based on our findings and recommendations, they got grant money to make those improvements.
That's really important. I know that I've heard that there are a lot of times that, especially at medical facilities, that doctor's offices aren't, maybe you can get into the office, but you might not be able to get up onto the table, or your wheelchair may not fit into the spot that they like to be able to transfer. If you can't transfer, there's no opportunity for you to just be able to stay in your chair and be able to do what you need to do. Have you heard of anything that is trying to encourage making things more accessible for medical facilities, or what do you tell people
Yeah,
trying to find them?
Yeah, you're exactly right. So there are currently no accessibility requirements for like what they call medical diagnostic equipment, things like that. There was progress being made a few years ago, and they actually released what they call a notice of proposed rulemaking. And I know a lot of advocates, including Paraquad, wrote comments and gave our feedback on what we would like to see and what we think those standards should be for exactly what you were saying, like medical exam tables, scales, any, mammogram machines, anything like that. And since then, there has not been any movement with these rules. Rulemaking is often a long process, but it has not gone anywhere. But it's certainly on a lot of people's radars, and advocates know that it is an issue. It's just another way that it's just another huge barrier for access for people, access to healthcare for people with disabilities. Yeah, and I just lost my train of thought. So yeah, I mean, if you think about it, if you're a person with a disability, it's, it may be a difficult thing to even get health insurance, but then if you do, maybe you have employer-sponsored health insurance, maybe you have Medicare or something like that. So you've got the health insurance, but then you can't even, if you can get into the actual office, which that isn't always the case.
Right. Yeah.
You can't access any of the equipment or get any of the exams. So, I've heard of so many people that have gone years and years and years without actually knowing their actual weight, because there's no way to get weighed.
Yeah.
It's pretty scary. So yeah, medical equipment. A big issue we hear is the need for sign language interpreters and the unwillingness of a lot of businesses to provide them.
Yeah.
So it would be the business owner's responsibility to provide a sign language interpreter for someone who is deaf or hard of hearing, if that sign language interpreter is needed to have effective communication, which may not always be needed. You just have to think about what the transaction is, what the service is that's being provided. Are written notes going to be sufficient? Can you text back and forth with the individual?
Yeah.
Things like that. But definitely if it's a medical appointment or a legal appointment, a sign language interpreter, if ASL is that person's primary way to communicate, that's going to be what's needed for effective communication.
Yeah.
And there's such resistance out there, like from day one until now, for businesses to pay for the interpreters. So there is an exception if it's an unreasonable burden to make that accommodation, then they're not going to be required to do it.
Right.
But if you're talking about a medical facility or a legal office, it's almost always going to be reasonable for them to provide that interpreter.
Yeah, and I know that they will provide like language interpreters for like, somebody who speaks here in St. Louis, Bosnian perhaps. But it tends to be a lot harder to get the sign language.
Yep. So I think there's still a lot of education that needs to be done about that. Maybe education about where folks can get those services right. And again, with technology, you can do like video interpreting. There's more options that have come along in the last couple of years for sure.
Yeah.
So sign language interpreters. The other big issue that I hear a lot about is service animals. So it's quite the hot topic, and it has been for years. So it's really interesting. In 2010, they actually changed some regulations under the Americans with Disabilities Act, and one of them had to do with service animals, and it said, as of 2010, it can only be a dog. So it's a service dog is a dog that's been individually trained to perform tasks or work for a person with a disability. And it gets a little confusing when you hear all these stories about airplanes and emotional support emotional support animals and stuff like that. But there's a couple different laws going on. So, but if you're strictly talking about taking a service animal into a business in the public or into a state or local government office or onto a metro bus, then it's the dog that's been individually trained to perform work. And so many businesses call about, somebody had a support rabbit once. And they're just so unsure about what the law says and what they can ask, and they don't want to be disrespectful. So that's where I think just the education and awareness can be really important, so business owners and people with disabilities know what their rights are. So knowing that it now isn't a dog and it has to be individually trained. You don't actually have to show any certification or registration for the service animal, but you do have to have your service animal under control at all times. So if it's acting up or growling or whatever, the business owner has the right to ask you to remove your service animal without a doubt. So when we do presentations for almost anybody, we talk about service animal etiquette and how to remind folks that service animal is working. So you really don't want to distract them at all. It's not appropriate. It puts them and the owner in danger. So you don't want to run up and start petting it. You don't want to feed it, any of that stuff. It happens all the time. I've got a coworker who uses a service animal. She said somebody threw a piece of pizza at it once.
Oh no!
I'm like, okay. So just always ask the owner, can I pet your dog? And sometimes they will let you, and sometimes they won't.
That's just a good dog etiquette in general.
I think so too.
Extremely important for service animals.
I think so too. Let's see. So any kind of policy that a company or business or program might have. One that's used a lot as an example is that In order to sign up for a particular service or something, or a program, you have to show a valid driver's license. So we really, and that often is included in job descriptions as well. So we always caution people to really think if that driver's license is what you need, or if it really is just an ID, a picture ID. Is a driver's license necessary to participate in this? Because it could, so like myself, I don't have a driver's license, I just have a state ID. So it could really unknowingly,
Exclude people.
Exactly. Yep. So that's a big, policy modification that a lot of places have to make. So I talked about ADA centers, and then I touched on it a little bit with Title IV and the internet and websites being something that's really coming to the forefront now. It's really interesting because we talked for years about like the physical accessibility of buildings.
Right.
But for a lot of places now, your first point of contact for that business, or your only point of contact, is their website.
Yeah.
So you want to make sure that that's accessible to people with disabilities.
I think we have like some people from a variety of different organizations on who are watching, who may work for an area agency on aging or a Center for Independent Living or a similar organization. Do you have any recommendations for where people can find resources on making their websites accessible, or even just like where to start?
Yeah, absolutely. So there's something called the WCAG, so the Website Content Accessibility Guidelines. I think I got that right. And that's a really great place to start. They sort of outline 4 big areas of accessibility that they call perceivable, operable, understandable, and robust. So the POUR. And they kind of go through what you want to look for on your website. There's also a couple of different website accessibility checkers that you can utilize. Some are free. So the WAVE, W-A-V accessibility checker, you can use that and just put your website in there and it'll spit back a lot of information that is a little hard to understand, but it'll give you a good overview anyways. What I always recommend, and it's the most useful, I think, is having people with disabilities use your website and get feedback from them. We've done it several times, and so I use a screen reader called JAWS. So when I'm showing somebody how JAWS interprets their website or navigates through their website, whether it's good or bad, they're pretty amazed. Like, they think they're doing all the right coding things and all that, and they're trying their best, but to see it actually being used by somebody that uses that assistive technology on a daily basis, it kind of opens up their eyes a little bit. So, that's what I recommend, just getting that user feedback is the biggest thing.
I also recently learned that in terms of, I don't know how many people are, I mean, social media is kind of a big thing. I don't know how many people are using Instagram, which tends to be like very photo focused, but I recently learned that they have an alternative text that you can add to every photo that you post that provides a description of the photo. And I've seen a trend of people some people provide a description just in the caption of the photo, and then some people are using the alternative text. I don't really know which one's better at this point, but I think kind of keeping that in mind, that describing a photo is really helpful for accessibility for people who have visual impairment.
Absolutely. It's a little bit of a pet peeve. I'm not a big Instagram user for that very fact. But it's just another one of those things that with time and practice, I think it'll become more and more of a just instinct to do that. Like, I'm going to post, so I need to do the alt text. And the same on Facebook. you can do the same thing with just doing the alternative text for a picture.
Okay.
Sort of the flip side of that too is if you're gonna post a video too, it's
Oh, yeah.
really important to have captions of some
Mhm.
sort. So, and that's that perceivable piece. So making sure any information that you put on there, an image, a video, is perceivable to anybody with a disability.
Right. And so that's really the alternative text for Facebook too. Like that's really important because sometimes people might post about an event and they just have like the flyer and just the
Yep.
picture and there's not as much detail in the caption. And if you can't see that, then you're not going to actually know what's going on with the event. Like you need to, it may seem redundant, but you really do kind of need to repeat the information below.
I've replied many times, what does this say? And like, it's no, I mean, everybody's just getting used to it.
Right.
And things like that, but it, you have to remind people and
Right.
hopefully it becomes habit then.
Mhm.
But yeah, that's a really good point.
Yeah. I just want to kind of put out there that if anybody has any questions, you can type in your chat window, and then if you are just calling in and you don't have access to the chat window, you can just kind of pipe in. We're very open to any questions that anybody has. Just want to put that out there. Did you have, sorry, I interrupted.
No, did you have any other thoughts of what you think the group would want to hear more about?
I guess, our organizations are, they do a lot of programming and stuff, and I'm sure that the Centers for Independent Living probably have a pretty good grasp, but maybe some of our organizations that are more aging focused or that are just kind of open to whoever, sometimes might have questions about like how do they make reasonable accommodations and programming. I went to an ADA training and there was a question about if your building's older and what should you do about like accessible bathrooms and I know it's really difficult, but every building's a little different, but
yeah. And again, it's been decided that it's an undue hardship to make any of those physical improvements to provide that accessibility. If you're gonna have something that's open to the public, like a meeting or an event, I would pick a different location if at all possible.
Yeah.
And then being, whenever you are marketing or advertising for your program or your event or anything like that, always somewhere where it's noticeable, include the language, if you need a reasonable accommodation, please contact, and then have the contact information of somebody who will respond within usually 24 hours. We have to always remind ourselves, oh, did we put that on the flyer? Did we put that on the post?
Yeah.
So then hopefully there's no surprises because you can't proactively provide accommodations for every scenario. And every person with a disability is going to need something different. So it really is, when we're doing disability awareness trainings, we say over and over, ask the person with the disability what they need. So that's the number one thing to keep in mind.
Right.
They're going to know what they need better than anybody else. So.
Would you say, since you brought up the issue of getting sign language interpreters, would you say that the best way to kind of find out where you could find a sign language interpreter would be to reach out to your local ADA center, or what do you think is the?
I mean, the ADA center, your Center for Independent Living, Google, it's going to be pretty easy to, yeah, definitely.
Does anybody in the audience have any questions or thoughts? I know that we'd mentioned it and we didn't really get to, I didn't get a chance to ask anybody to call in. what kind of advocacy efforts does Paraquad do on behalf of the ADA? Or like, what are some tips for advocating that you could throw out?
Sure. So we have some more formal and informal ways in which we advocate with the ADA. So we have a pretty formal program called Accessible STL,
Okay.
where we work, it is a fee-for-service program that we have, where we work with any business or organization or government entity in the community that wants to improve their accessibility. So we just kind of have a conversation with them, see what their needs are. We provide either trainings or the ADA accessibility surveys for their buildings. We look at their policies and procedures. Do they have a reasonable accommodations procedure? Do they have a process for requesting interpreters? Things like that. We've also looked at like building plans for new construction and gave some real practical feedback on that. I always say we're not architects, but
Right.
we can give that practical feedback of what may work best for the most amount of people. And then we also work a lot with like advocates in the community that have identified issues that they want to work on themselves. And so in a lot of those cases, we're just there for support, giving them some guidance on, well, this would be a good idea to contact this individual, or you know, you might want to show up at this meeting. Do you need some help in writing a letter to the editor, or do you need some assistance in writing some testimony, things like that. And we also send out a pretty regular newsletter called Advocacy Matters.
Okay.
So anybody that's signed up for that, we keep them up to date on a lot of current legislation, especially right now that's going through the Missouri State Legislature that impacts people with disabilities. We let people know about different events and opportunities that are happening in the area for advocacy. You'll see in the next couple of weeks advertising the annual Disability Rights Legislative Day, which is a huge event that organizations and advocates across Missouri go to the state capitol. It's on March 11th this year.
Okay.
And they have a huge rally, and then they make legislative visits and tell their legislators about the issues that are important to them as a person with a disability. So we help organize a couple of dozen folks from the St. Louis area to go down for that.
Very cool.
Yeah.
Doesn't look like we have any questions so far. I think that I asked most of the questions that I had. I don't know, do you have any closing thoughts or?
So a couple of other things that are really cool that we have at Paraquad, and I know other organizations, other centers for independent living have, is some assistive technology and durable medical equipment.
Okay.
Available to either check out, or we give a demonstration of it, or a lot of our durable medical equipment that we've gotten donated to us, we'll donate back out to the community for free.
Okay.
And getting access to that type of thing I know can be pretty difficult for a lot of people. So just knowing that those types of resources might be available in your area would be really good. And that's all. So a lot of that is run through the Missouri Assistive Technology. And they know who all the local centers are that do that. So.
Right. Yeah.
Yeah.
Great. So Kimberly had some handouts. I will see if there's a way that I can attach them, or at least post them to the website when we get this recording posted as well. It will be closed caption. So if anybody is on the call now and would like to get access to the handout before the webinar gets posted, because it might take us a couple weeks, please feel free to email me at bminor@woostel.edu. So that's going to be B as in Brittany, and then minor, MINOR, like someone under 18, at wustl.edu. So if you'd like a copy of that handout, go ahead and shoot me an email and I'll make sure to get it to you. And this will be available on our website, which is cedarmidwest.org. Oh, it looks like I have a question. Hold on. Redefinition of disability. Can you talk about the regarded part of the definition?
I can. So there's sort of a three-pronged definition of a person with a disability, just a person with a physical or mental impairment that substantially limits one or more major life activities is the first one. The second is having a record of having a disability. So maybe somebody that has cancer and has that medical record of a disability. And the third one that this person is referring to is regarded as having a disability.
Okay.
And it's a pretty tricky concept to kind of understand. And I think it really plays into the attitudinal barriers that we have in society for people with disabilities. And so the best thing, the example I give often is, so maybe somebody has some major scarring or something on their face from a past event of some sort. And folks, by just seeing that, automatically regard that person as having a disability.
Okay.
And they do something discriminatory based on that assumption. So then that's where you can utilize that third prong of the definition to, fight against that discrimination. And how you cannot use it is if, so you're that person that may sometimes be regarded as having a disability, but you don't actually have them, is the key thing. You can't then request reasonable accommodations from your employer. You don't actually have a disability. But if you are experiencing discrimination in some other way based on the fact that somebody thinks you have a disability, then you have rights in those situations. It's really difficult because you have to, unless it's written somewhere, you have to kind of get inside the head of somebody discriminating against you,
right,
and know the reasons why. So it is a bit of a tricky one, and I'll say it doesn't get utilized isn't the right word, but there's not many lawsuits or actions or anything for the most part utilizing that third prong of the definition.
Okay. Does that answer your question, Jessica? Perfect. Okay. Are there any other questions before we close out? I think this was a really great talk that we've had so far, and I so appreciate you coming over, Kimberly. I think we can also potentially list your contact information if people have questions. Is that all right?
Oh, absolutely.
Okay,
yep.
Great. All right. Well, thank you again, and thank you all for calling in. If anything comes up, you can feel free to email me. We'll also post Kimberly's information, so you can contact her, or I can pass it along in the meantime, and we'll make sure those handouts are made available.
Sounds good. Thanks, everybody.
Thank you.